Yeah, so this study is a phase 2 multi-center investigator-initiated study that's looking at the efficacy of Epcoritamab versus observation for patients with large B-cell lymphomas who achieved a partial response based on day 30 PET-CT post-CAR T. So as we know, most patients who receive a partial response at day 30 end up progressing, usually within the first 6 months, but yet the standard of care is still to closely observe these patients, and there hasn't been anything that's demonstrated efficacy to intervention at that time. And so this study is designed to see if Epcoritamab can increase the conversion to CR rate for these patients. And so study design is patients will be randomized 1-to-1 to either Epcoritamab or observation. They'll be stratified by line of CAR T and CAR costimulatory domain, either CD28 or 41BB. Patients randomized to the Epcoritamab arm will receive 12 cycles or 12 months of Epcoritamab, which is different than the approved label for Epcoritamab. Currently, it's continued indefinitely until progression or intolerance. And then we will be assessing with PET-CT scans every 3 months to assess response and continue to follow patients for 1 year after they complete Epcoritamab therapy. The primary objective is to evaluate the overall best CR rate of Epcoritamab compared to observation for patients with large B-cell lymphomas who have a partial response at day 30 post-CAR T. Other secondary endpoints include other measures of clinical efficacy such as PFS, OS, EFS, duration of response, duration of complete response, and overall response rate. Key inclusion criteria includes an ANC greater than 1,000 or hemoglobin greater than 7 or 8, depending on if the patient is symptomatic, and then a platelet count greater than 50. However, we are not excluding patients based on if they need red blood cell platelet or growth factor sports. There's no restrictions in the timing of receiving a red blood cell or platelet transfusion or GCSF. Other organ function is pretty standard in terms of creatinine clearance greater than 45, and performance status is going to be between 0 to 2. In terms of exclusion criteria, so patients are allowed to have CNS involvement, and if it's not currently active, the patients with active CNS disease, either based on symptoms, LP, or MRI, are excluded. Patients who have a history of grade 4 CRS or grade 4 ICANS are excluded, and if they have any active or ongoing CRS or ICANS at the time of day 30 PET-CT assessment, that's also an exclusion criteria. Patients cannot be treated with any prior CD20 or CD3 bispecific antibody or have received a CD20 monoclonal antibody within the past 4 weeks. Patients with HIV are allowed to be enrolled if they have an undetectable HIV viral load and are stable on antiretroviral therapy. So we are trying to keep the inclusion and exclusion criteria pretty reasonable, since patients can have prolonged cytopenias post-CAR T, and we know that's a key barrier to clinical trial enrollment for these patients. We're also planning to look at a number of correlative studies in this study, so looking at cytokine analysis, T-cell function, and phenotype, and also the impact of Epcoritamab on CAR T persistence. We're measuring that by qPCR and assessing this both baseline prior to treatment and post-treatment with Epcoritamab.